Hello, my name is Dr. Anamika Joshi. I'm an oculoplasty specialist. That means I'm an eye plastic surgeon. I practice in Hyderabad, and today I'm going to give you all the details about artificial eye surgery. Now, artificial eye surgery is mainly done for patients who have lost their vision for some reason, like either infection or some sort of trauma, some sort of eye cancer. And for these patients, vision cannot be brought back. That means the nerve of the eye, that's called the optic nerve or the retina, these are completely dysfunctional. There is no vision. And only thing that we can do for these patients is cosmetic improvement. So if the eye looks disfigured, it looks whitish, small or bigger, and it's not matching to the other eye, cosmetically it kind of reduces somebody's confidence, then these are the reasons when we prefer artificial eye surgery. Please remember that artificial eye surgery is not done to bring vision back. In case if somebody has problem only in the cornea, that is the black portion of the eye that we see, and their retina and optic nerve is good, then we do corneal transplantation and we can get the vision back. However, if the nerve is gone, there is absolutely no vision potential, then artificial eye surgery is done to improve the cosmesis and not to bring the vision back. There have been a lot of research about complete eyeball transplantation, but that is not available in any parts of the world currently where we can transport the whole eyeball. So please understand that artificial eye surgery means only cosmetic improvement and no vision gain. Now let's understand the process of this surgery. What exactly is done? Now this surgery is called evisceration with implant surgery. So what we essentially do in this surgery is the outer part of the eyeball, that is the sclera, is preserved and the inner contents of the eyeball are first removed and are replaced by an implant. The most popular implant used is the PMMA implant. Apart from that, there are other implants which are available based on surgeon's preferences and patient factors. So once this implant is placed, it adds a sort of volume which is required for normal looks, right? So we first put an implant and we kind of make space and volume so that the prosthesis can sit over it. An important thing here is we always preserve the muscles of the eyeball so that the eyeball can still freely move after this surgery is done. Now, how do we do this surgery? So first we give local anesthesia injection. Generally, if it is an adult. For kids, obviously, we have to give them general anesthesia. So once we give them anesthesia injection, then the surgery starts. It takes around 1 hour for us to finish the surgery. Once the surgery is done, we usually tell the patients to be in the hospital for a couple of hours and we discharge the patients usually on the same day. We patch the eye and we remove the patch usually the next day. Once the patch is removed, you will see some normal post-operative swelling, a little bit of watering, slight pain. Those things are normal post-surgery for a couple of days. Slowly, the swelling reduces. By 1 to 2 weeks, patients feel very comfortable. They can start going to work also. And then once at 1 month, when all the swelling is gone, that is when we have to place the prosthesis. Now this prosthesis is customized for each patient. I don't use ready-made prosthesis for my patients. I customize it with the other eye. We measure the size, the shape, everything, and then we also see what is the color of the other side iris. We can either hand paint it, or the newest technology that I use for my patients is digitally printed iris, where the exact iris, how your eye looks on the other side, that is exactly printed first, and that template is used to make your prosthesis. That's the latest technology in artificial eye. So we use that to make our prosthesis so that the prosthesis looks exactly similar to your other eye. Now this prosthesis can easily be placed inside the socket of your eye, and you can place it yourself. Slowly, patients learn easily how to do that. Now, this prosthesis, as I said, we preserve the eye muscles. So this prosthesis has movement also.
So once you look in any directions, you will see that your artificial eye is also moving. The movement is generally around 50 to 70% that of the natural eye. It could be more in some directions or less in some directions. Also, this is like a permanent procedure. So the surgery that we do, the implant that we place first, that is sort of permanent. The prosthesis, however, we recommend the patients to change it every 10 years because the shape and size, the color, everything of the eye keeps changing with time. So every 10 years you can make a new prosthesis for yourself. How do you maintain the prosthesis otherwise? Every year you need to polish the prosthesis. That is just a 5-10 minutes process, just like how we polish our shoes, so that there is no friction and you feel comfortable with the prosthesis. Also, every month you can just gently wash the prosthesis with soap water. That should be enough. You don't need to take it out otherwise. Once in a month, taking it out and washing is enough. And patients fear, what if it falls or something? It doesn't fall. If your surgery is done correctly, it will stay nicely and it won't fall or anything, even if you do any physical activity. Also, a common question that my patients ask me, will anything happen to the other eye after this surgery? So, answer to that is no. Absolutely no. 100% no. There is no risk to the other eye and you don't have to fear about it at all. It will not be mentioned in your consent also because these two eyes are anatomically separated and this surgery doesn't breach any such boundary. So don't worry about that. Other than that, this surgery is extremely safe and gives very good results. Our patients are very happy after choosing artificial eye surgery. Their self-confidence, their cosmesis, everything improves greatly. So if you have any such problem where your blind eye looks disfigured and you want this prosthesis, then please approach us for the same. You can call on this number flash below. I also give online video consultations. You could also go on my Instagram where I keep putting regular updates about this surgery. Thank you.